For our group project this semester, we focused and analyzed Rite-Aid's history, growth, strategies, and successes. Just a quick background and run through of how Rite-Aid has become the third largest drugstore chain in the U.S. We see this timeline here. To highlight some of their biggest successes, we see here in 1962 they opened their first store called Thrifty Discount Center. 1968, they expanded to 5 other states and officially became what they are known as today, Rite-Aid. 2 years later, they became public and started selling stocks at $25 a share. And then over the next 10 years, they became the third largest drugstore chain in the U.S. 1987 rolls around. They celebrated their 25th anniversary by acquiring 420 stores on the East Coast, which places them as the biggest drugstore retailer in the country as far as number of stores go. They had about 2,000 store locations. After yet another large acquisition, they were able to expand into the West and Gulf coastal regions, adding another 2,000 stores. And then a few short years after that, they had their largest acquisition. They partnered with GNC and had the first GNC store-within-store partnership, which was pretty big for them. 2007, Rite-Aid purchased Brooks and Eckerd drugstore chains, making them the largest drugstore chain on the East Coast, still placing third largest in the country behind CVS and Walgreens. In the following years until now, Rite-Aid has worked on several different things, which will be a constant process, including rebranding, constantly trying to meet the needs of their value-driven consumers. So after looking at that background, you can see Rite-Aid has partnered with and acquired several different companies over the years. They've incorporated synergy, acquisition, stopping competitors, staying ahead of technology, and vertical integration as core components of their key strategies in their business model. Their partnership and store-within-store situation that they had with GNC is a great example of how they used synergy and working together to improve processes and experience for customers overall. And pretty obvious, their biggest key strategy was acquisition, combined with stopping competitors, as they've acquired several very large companies that has put them on that fast track to becoming one of the largest drugstore chains in the country and the largest one on the East Coast. Rite-Aid has also made sure to stay ahead of technology. An example of how they've done that is their patent for the prescription filling software that automates the process. They just made sure to stay ahead of the times. Lastly, Rite-Aid relied on external sources in order to further their growth, as many other companies do. Most, I would say. However, Rite-Aid continued to effectively manage revenue and cost over the course of 20 years and were eventually able to gain proprietorship of several assets, including manufacturing facilities and logistics. They have efficiently brought different areas of the value chain in-house to further control over the entire consumer experience, from manufacturing to distribution and ultimate sales.
In order to successfully implement business strategies, it's important to look at 8 general environmental factors that help shape the landscape that a business is operating in. And the reason why it's important to look at these is because these 8 factors affect the profitability of a company. And those 8 factors are complementary products, technological change, general and economic conditions, demographic forces, ecological/natural environments, global forces, political, legal, and regulatory forces, and social/cultural forces. And so these 8 environmental factors are what managers need to be looking at in order to correctly assess opportunities and threats that are currently in the industry. For Rite-Aid specifically, we want to look at two environmental factors that have the biggest effect on the profitability of Rite-Aid. And the first is complementary products. Some examples of complementary products that Rite-Aid deals with are the healthcare industry prescribing pharmaceuticals and medicine, delivery services, passport photos for travel, and COVID-19 vaccinations. And with Rite-Aid, these complementary products are actually an opportunity or a good thing for them, as they're able to use these complementary products together, and at that point they're worth more together than they are separate. The second environmental factor that we want to look at is the political, legal, and regulatory forces. And some examples of these are FDA restrictions on various products and law amendments regarding the abuse of prescription drugs. Because they deal with a very important industry, they also have to be accommodating to the government and what restrictions they're putting into place. And so overall, it's important that managers are constantly looking at these eight sources so that they can correctly assess the opportunities and threats that the business may be facing.
Now, looking at the environmental factors and how they impact the five forces, first we're going to cover rivalry. Now, rivalry has a high risk due to the fact that the industry giants that Rite-Aid is competing with would be CVS and Walgreens. With nearly 8 to 10,000 stores in the U.S., while Rite-Aid only has around 2,500 stores, this is difficult for Rite-Aid as their presence isn't as strong within the retail pharmaceutical industry. Now, the experience that a customer may face when they walk into a Walgreens, a CVS, and a Rite-Aid would be very similar, though. So this is where Rite-Aid isn't lagging behind as much as some may say, where, if a customer goes to a Walgreens, CVS, or Rite-Aid, the experience is going to be similar. It's based on convenience, location, the experience that customers had. Now going into buyer power, this is a very low risk, not much of a problem for Rite-Aid, just due to the fact that physicians do not have the ability to profit from the sale of the drugs. Insurance companies only have the say in how much they will pay their distributors. Now supplier power, also a low risk. Retail pharmaceutical companies aren't worried too much about the supplier power, because that is also not really affecting the pricing of the drugs and their ability to operate. Threat of new entrants for Rite-Aid is not a big risk because they are larger in the industry, might not be as large as Walgreens or CVS. They do not have the issue of dealing with new entrants as often as you may think. Now, new entrants do have the hurdle of dealing with the innovation issues, where Rite-Aid, CVS, and Walgreens are innovating continuously. They're lowering the costs of medicines and products, and so for a new entrant to come in and be profitable, it is very difficult. And so it's not a big risk for Rite-Aid or these other industry giants. And lastly, substitutes. We found this as a medium risk due to the fact that a lot of people can find alternative medicines, natural medicines, and so they're turning to that more often than they used to. And also, people have the ability to simply make a phone call, get online, and order similar products from an online store rather than going to one of these brick-and-mortar locations.
Some of the major threats that Rite-Aid is currently facing are competitive innovation and advancement. Rite-Aid has some other very, very large competitors who spend a lot of money in innovation and advancement, whereas Rite-Aid is more focusing on the concept of wellness. And so this could potentially be a threat if Rite Aid were to, technologically fall behind. Another threat that they're currently facing is the decline in qualified pharmacists. Pharmacists have to go to many years of school, and there are just less people who are doing that. Some other things are legal restrictions and regulations. The government is constantly updating these, so it can be difficult to keep up with that. And then the last is retail consolidation. Lots of industries are moving more and more online, and so with Rite Aid having so many physical locations, this could be a potential issue if things were to go even more online.
In regards to the opportunities that Rite Aid has, telemedicine and mail order would be the first. Where many of their competitors are doing this, they have the opportunity to improve on this process and bring in more clients and appeal to those that want to do it remotely or come into the store as well. This is also an opportunity for increased need for pharmacists due to environmental and cultural changes that are happening today. Vaccines, tests, and other medications have seen an increased need, and that's not something that can be done online. And so, pushing that need for a brick and mortar retail pharmaceutical company, a store that they can go to receive these tests and these vaccines is very, very high as an opportunity. Affiliation and Medicare. Because Rite Aid is affiliated with Medicare and other propagated programs, it does help promote key aspects of the business. And lastly, brand recognition. Being that location that people want to go to get their medication, that's trusting. People know Rite Aid and they know the service that they're providing is key, and it can continue growing their business and stand out in comparison to these other industry giants such as Walgreens and CVS.
Moving on to the key resources that Rite Aid has at its disposal, we'd like to discuss first those resources that make it through the entire VRIO model. These being strong financial assets and management, proprietary technical patents, distribution systems, pharmacist-centric strategies, and a refreshed patient waiting area. These are the things that really set Rite Aid apart in terms of being able to utilize the resources to manage their different strategies more efficiently and help them stay ahead of the competition. One thing, first and foremost, financial assets and management. They stand alone when it comes to how available this resource is in comparison to other firms within the retail medicine industry. Due to a widespread number of retail locations, it's obviously valuable. It's deemed as rare within the industry as there are only a few other competitors that have scaled to a similar level. Due to large players in the market, strong and competitive financial management is inimitable at such a scale. Next, we have proprietary technical patents, meaning knowledge or processes that have been formally patented through the government that nobody else has access to. These namely involve pharmaceutical fulfillment processes, and Rite Aid makes strategic decisions to patent different strategies for calculating and computing anything in relation to fulfilling pharmaceutical orders. And it goes without saying that Rite Aid's own patents are highly inimitable. These other firms don't have access to this knowledge or this process, leading to a long-term success, thus sustaining a competitive advantage over time. Next, we have the distribution system. From a modern lens, the scale of distribution that Rite Aid operates is well ahead of par. From a competitive standpoint, there would be too much to invest in distribution in order to feasibly compete. These smaller firms can't keep up with the scale and the growth that Rite Aid has been able to produce over the years. This has been through various acquisitions, taking over those ma and pa shops on the East Coast and replacing them with Rite Aid locations. And it allows for optimal product dispersion over the entire nation, which is where their market is limited to. Next, we have a pharmacist-centric strategy. Rite Aid actually prioritizes the quality of their pharmacists above all else, whereas you'll get service from various technicians, other trained professionals, If you go to a Walgreens or a CVS, you won't have that same availability and access as you would going to a Rite-Aid and actually being able to converse with a qualified, knowledgeable pharmacist. It's hard to imitate due to the unique nature of standards. They prioritize education, they prioritize experience. They really just want the pharmacists to be the stars of the show. After all, that's the focus of their niche. And then finally, a refreshed patient waiting area. If at any time a patient comes and receives any sort of treatment, whether that coming vaccine or getting blood pressure analyzed, taken, whatever, things of that nature, it makes it a more comfortable experience. It doesn't make patients feel like they need to speed up their process, to apologize for taking time, and rushing through the whole buying experience. And the research that gone behind it has proven, more customer loyalty, and that's costly and lengthy to imitate. Whereas these other firms want people to get in and out, and they want to go through the transaction process as smoothly and as quickly as possible. So when we look at these resources in the context of the VRIO model, there are only a few that stand out. And you really just wanted to hone in specifically on these 5 key resources that we mentioned, and show the differentiation that Rite-Aid has been able to achieve while sustaining a competitive advantage in this realm.
So when looking at the financial metrics of Rite-Aid and comparing them to 3 of their competitors, CVS, Evernorth, and Walgreens, we can immediately notice that Rite-Aid is, from what it seems, performing financially much worse than other companies, only second to Walgreens, who is similarly close to them in operating income margin and EBIT margin. If you're doing some quick math, you might notice that Rite-Aid is anywhere from 67 to 150% less than these competitors, especially net income margin. And reason for this that we identified as a group is because they're reinvesting a lot of their revenue or their profits back into the company to help grow its brand, so the Rite-Aid brand, and being a environmentally friendly company, and also making sure that where they're sourcing their products from are sound decisions and sound places. Another place that they're reinvesting their operating income into are their stores. Their storefronts are changing. They're trying to make it a more comfortable environment for their members, for their clients. And also, Rite-Aid is taking the time to seek out top talent, whether it's pharmacists, whether it's the pharmacist assistants, or if it's just front-end staff. Rite-Aid is taking the time to seek out those people. And as you reinvest that money back into the company, you will see a loss in net income. As Rite-Aid continues to grow, hopefully we should see this net income margin rise, as seeing they won't have to invest quite as much money into these processes or into these things. Another thing I'd like to point out is that Evernorth is doing 20 to 30% better when comparing them to CVS or Walgreens. One reason for this is because of all of the partnerships that Evernorth currently has. So back in, I think it was 2017, 2018, Evernorth acquired Express Scripts, which was the largest e-provider of prescriptions in the United States. And then Evernorth was also recently acquired by Cigna, the health insurance company, and they were able to tap into Cigna's vast, I guess you could say, networking. And with this, they're able to grow their margins, and we can see that here, that two of the three margins on here are showing above 5%, which is decent when looking at other pharmaceutical companies. One thing I would like to mention about Evernorth is because of their recent partnership with Cigna, they now can tap into people or a network of 180 million clients and they're also in the international space of 30 countries. So when looking forward for Rite Aid, some potential partnerships or opportunities is for Rite Aid to look at branching out or connecting with other companies. And I know they're in the works with working with Medicare, which should help get more clientele into their stores. But another thing they should look at are other companies that can help them increase their international presence and gain revenue that way.